I'm making this short video for the members of the Estrogen Dominance support group, and I'm making this to help you to understand exactly what is precipitating the state of estrogen dominance, what it means. But in this video, you're also going to have a better understanding of what defines the normal menstrual cycle, how to understand what drives the different parts of the cycle, and how to count your menstrual cycle in case you do want to do some testing. You'll notice here that I've drawn out a 28-day cycle on my iPad here. But it's important to understand that that's an average number of days between menstrual intervals. It's thought to be normal if a woman has a 24-day interval or a 32-day interval, providing that she is ovulatory. So what I want to do is first define the different aspects that make up the primary hormones that are responsible for ovulation, which are LH, and then estrogen and the progesterone as well. So what I want to start with is a short graph showing what's happens with LH, which is really our hormone of ovulation. It's flat over the beginning and end of the month and spikes up around day 14. Now, the important thing to recognize is that this second half of the cycle, day 14 to 28, is what's tightly conserved. So if you're on a 24-day interval, it means that you are likely ovulating on day 10, which is 24 minus 14. Conversely, if your periods fall on a 32-day interval, you're going to be ovulatory on day 18. This is important because if you are doing LH testing, it can get kind of expensive. And I just wanted to give you some guidelines to know approximately when you're ovulating. And because if you wanted to have timed intercourse as well to try to precipitate pregnancy, that's going to help as well. So let's do this. Let's now look at estrogen and progesterone. I'm going to draw out estrogen as pink, and estrogen typically has two peaks over the course of the month that look something like this. Progesterone, the pregnancy hormone, progestational, is almost immeasurable in the first part of the month. And then what it does is it rises up in the second part of the cycle in response to the progesterone made by the corpus luteum, which is known as the yellow body. It's important to know here that it's thought that this decline in progesterone at the end of the month is what is going to precipitate the onset of the menstrual cycle. And when you're counting your menstrual cycle days, know that if you're spotting for a day or two before your cycle starts, those don't count as day one. We typically count the cycle starting on day one of the first day of flow. But what I want to do is go over what happens here with progesterone. So again, progesterone rises up at ovulation, and what you'll notice here is I've almost drawn progesterone and estradiol to be about the same level. We all know that they have different levels in the body, but I'm doing this to prove a point. And that is, let's just say right here, the relationships of estrogen and progesterone are 1-to-1. But in the case of a woman who's under a lot of stress, she's nutritionally deficient, she's toxic, inflamed, infected, or in a state of hypothyroidism or too much insulin in the body in sort of a pre-diabetic state, she doesn't ovulate as well. And this is characterized by a progesterone rise, which is lower in the second half of the cycle. So I'm going to draw two potential cycles here, all right? And what you'll notice that in this first cycle that I've drawn, there is now a relationship between estrogen, which is pink, and progesterone, which is green, of maybe 2-to-1. And in this last cycle, the relationship is 3-to-1. What I've drawn here is an ongoing development of a state of estrogen dominance. Now, everybody knows that there are a number of other factors that can contribute to a woman's estrogen-like state. And these are the presence of phytoestrogens, like the estrogens that are present in soy, or xenoestrogens, which are the estrogens present in any number of different man-made chemicals that can actually impact our estrogen receptor and act like estrogen. The purpose of this diagram that I made here today is to show what's happening with our endogenous hormones, the hormones that are made within our body. Now, many women can benefit with using supplemental progesterone. And while it's perfectly safe to use this over the course of the month, what I've found is that as we begin to use progesterone in the second half of the cycle, this more accurately represents a more robust ovulatory cycle and seems to help women with a lot of the estrogen dominant symptoms that develop through the course of the month. And typically these symptoms are things like headaches, breast tenderness, moodiness, weight gain, water retention, bowel and bladder functions, changes in libido. And what's interesting is that these signs that I just described, which are known as meliminal signs, at one point were found to be indicative of a competent ovulatory cycle. However, a 2018 study done at the University of British Columbia in Canada demonstrated that only about 40% of women who had these meliminal signs were in fact ovulatory, and a number were having high levels of anovulation. So understand that the state of estrogen dominance is a state of progesterone deficiency rather than an estrogen excess. And the best way to address the state of estrogen dominance is first put a Band-Aid on it. I mean, I think that using progesterone is very valid and very helpful in so many women. But you're also going to need to address the underlying factors that are precipitating this state of less competent ovulation and contributing to the estrogen dominant symptomatology. I hope that this short tutorial was valuable. Of course, if you guys have any questions, don't hesitate to reach out to me and ask them. I'll be sure to respond to everybody. And as always, have a great day. My name is Scott Resnick. I'm making these videos to empower you guys to be best stewards of your own health care and to turn around your health without using drugs when your doctor has been unable to. It's so important to understand the processes that are in play with estrogen and progesterone throughout the cycles. And of course, if you like these videos, be sure to like, subscribe, share them with your friends, or leave a comment. I'll be sure to respond to all your comments personally. As always, take care.